I think in general terms, exercise should always be favoured over medication, and exercise has a big role to play in the management of back pain. But we've got to be very cautious about making a blanket statement about back pain, because back pain on its own is not a diagnosis, it's a symptom. And so recommending one particular treatment technique as opposed to another for broad-based back pain is not appropriate. For example, back pain can be divided into acute or chronic. It can also be divided into severe, moderate and mild. And those three different symptom complexes indicates quite significant different pathology. For acute severe back pain, and pain being, to quote an old advertisement, is nature's warning, to try and exercise and move the spine when you've had perhaps a movement-related incident. And remembering most episodes of back pain are due to a disc herniation. It's an acute disc herniation where the disc ruptures and it becomes painful. And the accepted management technique for that, for an acutely ruptured disc, is rest. And that rest may be days to a couple of weeks. So blanketly recommending that someone, or universally recommending that someone should go out and exercise with an acute disc herniation is exactly what we don't want. Because if you have an acute disc tear or rupture, what you're trying to avoid is a more significant rupture, and exercise may well precipitate that. By bending and twisting and putting more pressure on the disc, it may cause it to herniate further and push on the nerve, culminating in sciatica, which may lead to nerve damage. So as a result, just saying exercise is more appropriate than analgesia is really not the case. If you've got, say, moderate chronic back pain, due to some underlying arthritis in the facet joints, or even in some discovertible arthropathy where the discs wear out and become a little bit painful, then yes, an exercise program is far more effective than medication in that case. So it really becomes an important thing to diagnose what the cause of the acute back pain is. And that at this point, most the recommendations for investigation for for back pain normally involve a delay period of about 6 weeks. But given the fact that most episodes of isolated mild back pain will resolve within 6 weeks, so they don't really need investigation. But to start recommending exercise versus medication as a blanket, as well as a universal sweeping statement, I think is too much of a generalisation. I think depends on the severity, depends on the length of time, and it depends on the individual. The ideal answer for anyone who gets significant back pain, anything more than that's three or 4 days, and most people, if they're acutely sore enough, will struggle through for 2 or 3 days, and if they've slept badly, they'll be better. But if you took everyone with back pain of significance and said, look, what's the best thing to do is get an MRI scan, and the problem is that's a $1,000 expense to the government, etc., etc. So there's a whole bunch of expenses in MRIs, and fast forward 100 years, as soon as you get as soon as you get your back pain, on the way into work, you'd step into the MRI machine and go, examine my back, great, it's minor, it'll be gone. Then you'd walk that's where we'll be in 100 years. But we're not there now. Again, so because it's still expensive, MRIs are, and getting every single individual back, who gets a back pain MRI scan would be hugely expensive. But on the basis of that, that's how you'd prognosticate. So when we get to that stage, so the question then is, who do you MRI and when? And that's still, taught to medical students how to, people with red flags, sort of saying, look, if you've got sciatica, nerve compression symptoms, dangerous symptoms, then yes, you go and get an MRI scan early. Otherwise, if it's garden variety back pain, you wait 6 weeks, or thereabouts. So there's all that, but you start going down little rabbit holes of very specific medical knowledge, sort of, or medical intuition on that. And I mean, suffice to say at this stage, doing an MRI scan on every individual who gets back pain, as soon as they get back pain, is financially too costly for the government and the system to utilise. So therefore we've got to be a little bit judicious about how you choose who gets what investigation. But in an ideal world, everyone would get an MRI scan so we could see exactly what's going to happen. So you could see, because virtually any pathology of significance you can see on an MRI.